talking to Dr. Rosie Laing, who is the clinical lead for collaborative care in Christchurch for some of the shared care plans. So I don't know if that title's completely right, Rosie, but just let us know what you've been up to, and it's about new technology, I hear.
Yeah, I guess so. As someone who's actually pretty rubbish at technology, my 18-year-old son laughs at me like, a great deal about my ineptitude with these things, that I have become really interested in how I've been involved in these care plans, partly because I do GP liaison work and I have some understanding about the wider health system, that how to make those technologies more usable, more accessible, and just a little less daunting for GPs to incorporate in their daily work.
Yeah.
Because I think we don't look hard enough at all these exciting new developments. What's it like at the coalface? Can the practice nurses access this? Is it easy to use? Does it make their day easier? Does it work for patients? Why do this?
And so how are you finding some of the I suppose there's GPs who do the same thing all the time and say, well, I've done it this way forever and I don't know that I need this new technology in my practice. So how do you find they're engaging and taking it up?
Sometimes very slowly.
Yeah.
And I think it's been really interesting watching some of the initiatives like Health One, which have been led primarily by IT people and by early adopters, enthusiasts who think this is the best thing since sliced bread, and how it's taken a long time for some other GPs to realise that it can be really, really useful. And the Health One has been one that I've been particularly interested in, because to look at the shared care plans that we're doing all the work on, you have to use Health One. So it's a rate limiting step for us.
So just so that people from outside of Christchurch know what Health One is.
Health One is essentially a portal which allows GPs to look at the hospital front page, so looking at labs and letters and any electronic records that the hospital hold. And it allows the hospital to look at general practice, dispensing and prescribing and classifications.
So similar to what other regions have, but just a different name. Cool.
Quite similar.
And so other things that you've worked on and that end?
Just trying to understand trying to get people who used to be skeptics, who've become enthusiasts, or who have found out that it really is helpful when you confront a certain situation, to share those experiences with other GPs. That just telling people how to do something doesn't help them understand why. How does it work? How can I incorporate it in my practice? Knowing what someone else does and why they love it is much more powerful than somebody coming and saying, well, here's the button you press, here's your password, this is great, just do it. And that gradually finding somebody in the practice, so there might even be one person who goes, oh, okay, I get this is quite useful. I've used it for this patient and this patient and this patient, and that really helped them telling the patient stories and telling the health professional stories about how they worked, how these new technologies helped, rather than just didactically saying, oh well, we've got this wonderful new thing and we want you to use it.
So a bit of storytelling going on.
Yeah.
And with some of those stories, what are the specifics that people come up with that are so helpful for them?
I think it varies depending on the sort of technology you're talking about. So I was part of the growth of watching, being involved in the beginnings of health pathways, and I've seen that grow from 5 pathways to over 800 pathways, and seeing that the way in which GPs use them and interact with them has changed over time, and that evolution is shared in peer groups, education groups, just over coffee within practices. It's usually peer-to-peer, but some of it is more formal as well. Realising you need to develop frequently asked questions, or write articles, or post stories on websites, and then tell people that there's something to look at. building it into your education programs, just getting people to see things in a whole raft of different ways in different contexts, because if it's not familiar, it's scary. If it's not being used within a context that you understand, you won't use it either.
Yeah.
If somehow it seems to be for other doctors, or you need special handshakes or passwords to get into it, it's quite off-putting.
Yeah.
And I think as health professionals, we've got so many choices about how we'd spend our time, our attention, our energy, the resources of our teams. Why would you do any of these new things unless they have real benefits?
Yeah.
And sometimes those real benefits will be quite individual to that practice or that doctor or nurse as to how they might choose to use them. And I think by listening to what your colleagues have done, and for us as developers, listening to how people use them, we learn from them and we learn from each other. But it just doesn't work to turn it on and expect everyone to get with the program.
Get with the program, yeah. I think that's probably seen quite often. So if someone was watching this and they're quite reluctant to get involved in using these electronic things, what would you suggest that they do?
Ideally tap on the shoulder of a colleague who is a bit more confident and say, look, can you just show me how to use this? And when do you use it? What's it good for? Why would I bother? What do you like, what don't you like about it? And often if you try, I think I find this with just ordinary technology, finding my way to Netflix that my teenager kept doing for me. And now that he's left home, I have to do it myself.
Yes.
And the first time you do it, it seems cumbersome, and the fifth time you do it, it seems obvious. And I think that's true with health tech as well, that once you get used to using it, you wonder how you ever manage without it. But it is an uncomfortable process, especially for those of us who are sufficiently old to have not grown up with that part of your brain that adapts instantly to new technologies and navigates it intuitively.
Yeah. And I think that's very true, is that we don't actually talk about the fact that it is uncomfortable, and that for some of us I remember learning to use eLab, and when they said to me, we've done the trial now, I said, do I have to stop using it because I've learnt this now and I don't want to stop? So, it is a hard yakka sometimes. And I think persevering and having some support, which it sounds like you're providing and helping encourage. It's really useful. So,
and finding tools that help people. Some people want to watch a video on how to do it. Some people want to read a pathway. Some people want a handout. Still want the piece of paper that they can hang on to and go back to, because apart from anything else, especially tools that you don't use every day, I mean, electronic referral management was quite easy to learn because we refer several patients in a week. And by the end of the week, you've got the idea of it, and you reckon it's much faster than writing a letter, so of course you keep doing it. But writing a acute plan is something you only do sometimes. And it's nice to have something to go to or hang on to that says these are the steps, and this is how it's funded, and this is what it was good for, and these are the patients that qualify, and so on. Otherwise, it's too hard to hold all that stuff in your head. What is for me anyway. And for many of us, I think. So thanks very much for talking to us today. It's been really helpful. Thank you.